CEN Written Exams Guide. Question 1. A patient with COPD and a history of hypercapnia is being treated with oxygen. The CEN should aim for a target SpO2 of Option A 100%, Option B 94 to 98%, Option C 88 to 92%, Option D 85 to 88%. The correct answer is Option C, 88 to 92%. For patients with COPD and chronic hypercapnia, CO2 retention, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia, depressing the hypoxic drive. The target for healthy patients is 94 to 98%. High oxygen concentrations should be avoided in these patients. Question 2. A patient presents with acute chest pain, shortness of breath, and a pericardial friction rub. Which ECG finding is most characteristic? Option A ST segment elevation in all leads. Option B PR segment depression and diffuse ST elevation. Option C Q waves in leads 2, 3, AVF. Option D tall, peak T waves. The correct answer is Option B, PR segment depression and diffuse ST elevation. Pericarditis is inflammation of the pericardium, presenting with acute chest pain, pleuritic, better leaning forward, a pericardial friction rub, and diffuse ST segment elevation, often concave upward, with PR segment depression. It is distinguished from STEMI by the lack of reciprocal ST changes and the diffuse nature of ST elevation. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 3. A patient with renal failure presents with fluid overload, dyspnea, and hypertension. Which intervention is a priority? Option A hemodialysis. Option B 4-furosemide. Option C 4-nitroglycerin. Option D, all of the above. The correct answer is Option D, all of the above. The management of renal failure with fluid overload includes 4-furosemide to remove fluid, nitroglycerin or other vasodilators to reduce afterload, and hemodialysis if the patient is not responsive to these measures. Dialysis may be needed for severe hyperkalemia, refractory fluid overload, or uremic symptoms. Acidosis may also require bicarbonate. Question 4. A patient with suspected C. difficile infection should be placed on which type of precautions? Option A contact precautions. Option B droplet precautions. Option C airborne precautions. Option D standard precautions. The correct answer is Option A, contact precautions. C. difficile is transmitted via the fecal-oral route, contact with contaminated surfaces or feces. Patients should be placed on contact precautions, gloves and gowns, with hand hygiene using soap and water. Alcohol-based hand rub is not effective against C. diff spores. Private room is preferred. Droplet and airborne precautions are for respiratory infections. Question 5. A patient presents with preeclampsia, headache, visual changes, epigastric pain, and elevated liver enzymes and platelets. This patient is at risk for Option A eclampsia. Option B HELLP syndrome. Option C placental abruption. Option D preterm labor. The correct answer is Option B, HELLP syndrome. HELLP syndrome is a severe form of preeclampsia characterized by hemolysis, elevated liver enzymes, and low platelets. It presents with epigastric pain, nausea, headache, and visual changes. HELLP requires immediate delivery to prevent maternal and fetal morbidity/mortality. Magnesium sulfate is used to prevent eclampsia, and delivery is indicated. Question 6. What is the most common dysrhythmia associated with acute myocardial infarction? Option A atrial fibrillation. Option B ventricular tachycardia. Option C ventricular fibrillation. Option D. Premature ventricular contractions, PVCs. The correct answer is option D. Premature ventricular contractions, PVCs. PVCs are the most common dysrhythmia seen in acute MI, often indicating myocardial irritability. While ventricular tachycardia and ventricular fibrillation are more dangerous, PVCs are more frequent. Atrial fibrillation can also occur but is less common. Reperfusion therapy and antiarrhythmic management are key strategies. Question 7. A patient presents with severe eye pain, headache, nausea, vomiting, and a cloudy cornea. Which diagnosis is most likely? Option A. Central retinal artery occlusion. Option B. Acute angle closure glaucoma. Option C. Retinal detachment. Option D. Corneal abrasion. The correct answer is option B. Acute angle closure glaucoma. Acute angle closure glaucoma presents with severe eye pain, headache, nausea, vomiting, a red eye, a cloudy cornea, and a fixed, mid-dilated pupil. It is an emergency requiring immediate reduction of IOP with topical beta blockers, alpha agonists, carbonic anhydrase inhibitors, and hyperosmotic agents. Miotic agents, pilocarpine, are used after the acute attack is controlled. Question 8. A patient with a suspected fracture has a pulse that is absent. The CEN should: Option A. Apply a splint and reassess. Option B. Apply a tourniquet. Option C. Reduce the fracture. Option D. Call for an orthopedic consult. The correct answer is option A. Apply a splint and reassess. If a fracture is suspected and the pulse is absent, the CEN should apply a splint to align the bone and reassess the pulse. If the pulse returns, the circulation is likely adequate. If the pulse remains absent, it may indicate arterial injury, requiring an orthopedic and vascular consult. Tourniquets are for bleeding control, not for absent pulses. Reduction is done by a physician, not by the CEN. Question 9. A patient with stable supraventricular tachycardia, SVT, is not responding to vagal maneuvers. Which medication should the CEN anticipate? Option A. Amiodarone 150 mg 4. Option B. Adenosine 6 mg rapid 4 push. Option C. Diltiazem 20 mg 4. Option D. Metoprolol 5 mg 4. The correct answer is option B. Adenosine 6 mg rapid 4 push. Adenosine is the first-line medication for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. The initial dose is 6 mg. If ineffective, a second dose of 12 mg may be given. Adenosine works by transiently blocking AV node conduction. Amiodarone, diltiazem, and metoprolol are also used for rate control in certain tachyarrhythmias but are not first line for SVT. Question 10. Which condition is characterized by paradoxical chest wall movement during inspiration, flail chest? Option A. Pneumothorax. Option B. Pulmonary contusion. Option C. Multiple rib fractures with a segment floating independently. Option D. Cardiac contusion. The correct answer is option C. Multiple rib fractures with a segment floating independently. Flail chest occurs when 3 or more adjacent ribs are fractured in 2 or more places, creating a freely moving segment. This segment moves paradoxically, inward during inspiration, outward during expiration, impairing ventilation. Pain control, oxygen, and possibly mechanical ventilation are mainstays of treatment. Question 11. A patient in the ED is agitated and at risk of harming themselves. The CEN should use which type of restraint? Option A. Physical restraint only. Option B. Chemical restraint. Option C. Physical or chemical restraint, as indicated. Option D. Seclusion. The correct answer is option C. Physical or chemical restraint, as indicated. Restraints, physical or chemical, are used to protect the patient or others from harm. They should be used as a last resort when de-escalation has failed. Physical restraints include soft limb restraints, chemical restraints include medications, haloperidol, benzodiazepines. The CEN should monitor the patient closely and reassess for the need for restraint. Question 12. A patient with a head injury has a GCS of 8. The CEN should: Option A. Intubate the patient. Option B. Elevate the head of the bed to 30 degrees. Option C. Administer mannitol. Option D. All of the above. The correct answer is option D. All of the above. A GCS 8 indicates severe head injury and a need for airway protection and management of elevated ICP. Intubation is indicated to protect the airway and manage ventilation. Head elevation to 30 degrees reduces ICP. Mannitol or hypertonic saline is used to reduce ICP. All interventions are indicated in severe head injury. Question 13. Which medication is used to manage postpartum hemorrhage? Option A. Oxytocin. Option B. Misoprostol. Option C. Tranexamic acid. Option D. All of the above. The correct answer is option D. All of the above. Postpartum hemorrhage, PPH, is managed with uterotonics. Oxytocin is the first-line agent, misoprostol and methylergonavine are second-line or adjunctive agents. Tranexamic acid is a recent addition to the management of PPH, reducing bleeding and mortality. Uterine massage, fluids, and blood products are also indicated. Question 14. A patient presents with a chemical splash to the eye. The CEN should: Option A. Neutralize the chemical with a buffer. Option B. Irrigate the eye continuously until pH is neutral. Option C. Patch the eye and refer to ophthalmology. Option D. Administer antibiotics. The correct answer is option B. Irrigate the eye continuously until pH is neutral. Chemical eye injuries require immediate and continuous irrigation with normal saline or lactated Ringer's solution until the pH of the eye is neutral, pH 7.0. Alkali burns are more damaging than acid burns and require extended irrigation. Irrigation should begin immediately and continue for at least 15 to 30 minutes. For severe alkali burns, it may take hours. Antibiotics and patching may be used after irrigation. Question 15. A patient with adrenal crisis, Addisonian crisis, presents with hypotension, hyponatremia, hyperkalemia, and nausea. The CEN should anticipate: Option A. 4-hydrocortisone. Option B. 4-normal saline. Option C. 4-dextrose. Option D. All of the above. The correct answer is option D. All of the above. Adrenal crisis is a medical emergency requiring 4-hydrocortisone, 4-normal saline, 4-hypotension, and 4-dextrose if hypoglycemic. Signs include hypotension refractory to fluids, nausea, vomiting, hyponatremia, hyperkalemia, and hypoglycemia. Prompt treatment prevents circulatory collapse. Hydrocortisone should be given before the patient is transferred to the ICU. Question 16. A patient with a seizure disorder is in status epilepticus. The CEN should administer: Option A. Lorazepam, Ativan, 4 mg 4. Option B. Phenytoin, Dilantin, 20 mg/kg 4. Option C. Midazolam, Versed, 10 mg IM. Option D. Valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Lorazepam is the first-line treatment for status epilepticus. It is a benzodiazepine that terminates seizures. If the seizure continues, phenytoin or fosphenytoin is given. Midazolam may be used if 4-access is not available, IM. Valproic acid is a third-line option. Airway management and ABCs are priorities. Question 17. A patient with status epilepticus has received lorazepam 4 mg for without cessation of seizure activity. The CEN should anticipate which next medication? Option A phenytoin 20 mg/kg4. Option B propofol 20 mg/kg4. Option C valproic acid 20 mg/kg4. Option D levetiracetam, Keppra, 1 gram 4. The correct answer is option A. Phenytoin 20 mg/kg4. After benzodiazepines, lorazepam, second-line agents include phenytoin, 20 mg/kg4, or fosphenytoin. Levetiracetam and valproic acid are also options but may be considered after phenytoin. Propofol is used for refractory status epilepticus. Airway management is critical, the patient may require intubation. Question 18. A patient with suspected carbon monoxide poisoning has a headache, nausea, and confusion. The CEN should: Option A administer high-flow oxygen via a non-rebreather mask. Option B obtain a CT head. Option C administer activated charcoal. Option D obtain a carboxyhemoglobin level. The correct answer is option D. Obtain a carboxyhemoglobin level. CO poisoning presents with headache, nausea, confusion, and cherry red skin, late sign. The diagnosis is confirmed with a carboxyhemoglobin, COHB, level. Treatment includes high-flow oxygen, non-rebreather mask. Hyperbaric oxygen therapy may be indicated for severe cases, COHB 25%, cardiac ischemia, neurologic symptoms, or loss of consciousness. CT is for head trauma, charcoal is not indicated for CO poisoning. Question 19. What is the most common presenting symptom of acute coronary syndrome, ACS, in women? Option A crushing substernal chest pain. Option B atypical symptoms such as shortness of breath, nausea, and fatigue. Option C radiating pain to the left arm. Option D syncope. The correct answer is option B. Atypical symptoms such as shortness of breath, nausea, and fatigue. Women, elderly, and diabetic patients often present with atypical symptoms of ACS, including shortness of breath, nausea, vomiting, fatigue, and epigastric discomfort, rather than classic crushing chest pain. This can lead to delayed recognition and treatment. Emergency nurses must maintain a high index of suspicion for atypical presentations. Question 20. A patient presents with a fracture of the tibia and fibula after a motor vehicle accident. The patient has a palpable pedal pulse and sensation. What is the initial action? Option A reduce the fracture. Option B apply a splint to immobilize. Option C apply a tourniquet. Option D perform a neurovascular assessment. The correct answer is option D. Perform a neurovascular assessment. The first step in any fracture assessment is a neurovascular assessment: pulses, sensation, movement, color, temperature. Even if the pulses are palpable, the CEN should document the baseline to monitor for changes. Splinting is important to prevent further injury, but neurovascular assessment comes first. Tourniquet is for bleeding control, not for fractures. Question 21. Which of the following is a clinical feature of a pulmonary contusion? Option A hemoptysis. Option B chest wall crepitus. Option C subcutaneous emphysema. Option D unilateral wheezing. The correct answer is option A. Hemoptysis. Pulmonary contusion, bruising of lung tissue, often results from blunt chest trauma. Clinical features include hemoptysis, hypoxia, and opacities on chest X-ray that develop over 24 to 48 hours. Chest wall crepitus and subcutaneous emphysema suggest pneumothorax or rib fracture. Unilateral wheezing suggests a foreign body or bronchial obstruction. Treatment is supportive with oxygen and pain control. Question 22. A patient with a migraine presents with a unilateral throbbing headache, nausea, photophobia, and phonophobia. What is the first-line treatment? Option A triptan, sumatriptan. Option B acetaminophen. Option C morphine. Option D metoclopramide. The correct answer is option A. Triptan, sumatriptan. Triptans, 5-HT1B/1D receptor agonists, are first-line agents for acute migraine, especially when the patient presents early. They are effective at aborting the headache. Acetaminophen and NSAIDs are for mild headaches. Metoclopramide is an antiemetic that may be given as an adjunct for nausea. Morphine is not recommended for migraine due to poor efficacy and risk of medication overuse headache. Question 23. A patient presents with heat stroke, temperature 40.5 degrees Celsius, 105 degrees Fahrenheit, confusion, and hot, dry skin. The priority intervention is Option A 4 fluids. Option B cooling measures, ice packs, cold water immersion. Option C antipyretics, acetaminophen. Option D neurological assessment. The correct answer is option B. Cooling measures, ice packs, cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. The priority is to lower the core temperature as quickly as possible using ice packs, cold water immersion, or evaporative cooling. Antipyretics are ineffective in heat stroke because the pathophysiology is not hypothalamic. Cooling should be done until the core temperature reaches 38.9 degrees Celsius, 102 degrees Fahrenheit. 4 fluids are supportive. Question 24. A patient with suspected influenza should be placed on which type of precautions? Option A contact precautions. Option B droplet precautions. Option C airborne precautions. Option D standard precautions. The correct answer is option B. Droplet precautions. Influenza is transmitted via respiratory droplets, coughing, sneezing, or talking. Patients with suspected influenza should be placed on droplet precautions, a surgical mask within 3 feet of the patient, and the patient should wear a mask when leaving the room. Airborne precautions are for TB and measles. Contact precautions are for C. diff and MRSA. Question 25. A patient with thyroid storm presents with fever, tachycardia, and confusion. Which medication is used to reduce thyroid hormone levels? Option A propylthiouracil, uracil, PTU. Option B methimazole. Option C propranolol. Option D. All of the above. The correct answer is option D. All of the above. Thyroid storm is managed with medications that block thyroid hormone synthesis, PTU or methimazole, and beta blockers, propranolol, to control symptoms, tachycardia, tremors, hyperthermia. PTU is preferred because it also blocks the conversion of T4 to T3. Cooling, 4 fluids, and dexamethasone are adjuncts. The CEN should anticipate ICU care for these patients.